Okay, so getting down to the last few slides of this lecture, right? We are way far down on slide 50. See, risks and complications. There are many, just as with any injection. Excuse me. Intravenous therapy can have numerous inherent risks and complications. The medical assistant should be knowledgeable in recognizing the complications, signs, and symptoms that may arise from IV infusion. The different complications can be classified as local, systemic, or a combination of the two. Local complications may include pain and irritation at the insertion site, cannula dislodgement, leading to infiltration, catheter or needle occlusion, phlebitis, which is an inflammation of the vein. Other complications may involve a hematoma, venous spasm, vessel collapse, thrombosis, and nerve, tendon, or ligament damage. And those all include local, meaning they're just confined to the site of the area that the IV was in. So, it is essential to communicate with the patient to assess complications of IV therapy or patient intolerances of the IV catheter. Once the medical assistant has determined the patient's pain level, relay this information to the provider. And you'll want to take a look at, to help you with assessment, you can take a look at Table 32-10, which is guideline questions for patient pain assessment, and Table 32-11, which are complications and risks of intravenous therapy. Moving on to systemic complications. These are much more dangerous and can be life-threatening. We want to take a look at Table 32-12 for signs and symptoms of systemic complications, and those include generalized swelling, erythema along the veins, trouble swallowing or breathing, flushing, agitation, anxiety, confusion, itching, etc. So always be aware of what to be on the lookout for when it comes to systemic complications. Discontinuation of IV therapy. So you want to use when a physician determines a patient no longer needs an IV infusion, it must be discontinued. The first steps include proper aseptic technique and the application of gloves. The IV tubing is clamped off and removed from the adapter or extension set. And you want to take care not to remove the adapter. This will cause blood to leak profusely out of the cannula hub. We're at it again, as you can see today. So we're going to remove the transparent dressing by rubbing the patient's skin with an alcohol pad, which will loosen the adhesive in the dressing. Once the transparent dressing is removed, the tape securing the cannula hub should also be removed. You want to make sure to not accidentally dislodge the hub from the site during this process. And when the tape is completely removed, prepare a gauze pad and place it above the cannula site. Inform the patient to take a deep breath, and when the patient breathes in, remove the cannula in one smooth and continuous movement while pressing down with the gauze. You're going to want to hold pressure on that. Please hold. A lot of distractions around here today. So once you've held pressure for 5 minutes, you're going to go ahead and document the removal in the patient's chart. And note any complications as well. Inform the physician if they are important or serious. So the last of our injections, the term intra-articular means within a joint. Some injections are given within a joint to help reduce inflammation and pain. Usually we're talking about patients with osteoarthritis of the knee or any sort of shoulder problems as well. Okay, so the medical assistant's responsibilities in this situation would be to prepare the patient for injection, prepare equipment, and they may hold the joint still during the injection. That finishes up the third part of this lecture, super short video, and that is the end of your module. So all we have left next week, well, we have a test this week on Chapter 32, and then a final exam next week on all of the chapters. It's been great talking to you guys on these lectures and talking to you within the forums. I hope you have a great last 2 weeks. And as always, I'm always on my email looking for your emails to see if you have any questions or problems. And good luck with your career.